Good evening, everyone, and welcome back to another episode of Mind Split Cafe. And today we want to announce our new partnership with Palms Behavioral Health in Harlingen, Texas. We are starting this partnership as of today. So we actually have Elizabeth on our show today, who is a part of Palms Behavioral Health. And of course, we got big man Matt.
What's going on, guys? Hey, Elizabeth. Thank you for joining the show.
Thank you for having me.
Tell everybody exactly what you do at Palms Behavioral Health.
And tell us what Palms is.
Sure. Yeah. So Palms is a psychiatric hospital that's located in Harlingen. A lot of people don't know what a psychiatric hospital is, right? Because everybody relies on what they've learned in movies and TVs, but really we're a hospital that deals with signs and symptoms you can't see, right? Medical hospitals deal with broken bones, heart attacks, physical ailments.
Mm-hmm.
Here, we deal with those signs and symptoms like anxiety, depression, and also those signs and symptoms that people don't really like to talk about, like suicidal thoughts, homicidal thoughts, delusions, hallucinations, things like that. Things that are more taboo or scary to talk about, right? So those kinds of patients, a lot of the times people in the community don't know where to send them, how to help them, how to understand or relate to them. So that's where they come here. And we can figure those things out, of course, with the patient and their families.
And is it an inpatient or an outpatient facility?
We actually do both. So if you think about like a hospital, right? I like to kind of play around with those two because people are more understanding of a medical emergency hospital, right? You have a broken leg, you need to go to the hospital, right? And they're going to decide what to do with your leg. They're going to mend it, right? Or is it just maybe a sprain, a little fracture that you can do something like a rehab, right? So for us, the inpatient is that emergency services. That means right now you need help, you know?
Mm-hmm.
So we will bring you into the hospital. We'll kind of figure out a plan how to get you back home. And then we have outpatient as well, which is a little bit more intense. You come in daily to run groups, to take your medications, things like that. But you get to go home at the end of the day and enjoy, dinner with your family, sleeping in your own bed, engaging in your hobbies, and then come back the next day and try it all over again. So those are kind of the differences. But a lot of people don't know that we have an intense outpatient program.
Yeah, no, I love the analogy that you gave with, intensive outpatient and inpatient being an ER. You got to be seen now.
Mm-hmm.
That was a really good analogy. So tell us a little bit about your credentialing, and then we can kind of go off into some topics that you'd like to discuss.
Yeah, definitely. So I am a licensed master social worker. I have my bachelor's in social work, my master's in social work, and I got there by going through a bunch of different fields. I was a pharmacy major, I was an accounting major, I was a chemistry major, but it really took me to take a sociology class to figure out I loved working with people, right? Math and numbers and all that stuff is great if you love it, right? But I just love the dynamics and the complexity of working with people because no two people are the same, right? And everybody has different backgrounds and need different things. So I went into that. I'm also working towards my clinical license to become an LCSW, and I have about 1 to 2 months left until I can test and get my clinical license. Yay! I know, I'm so excited.
Well, we'll have you back in 31 days from now when you pass your test, right?
Yes, that's the next step. Yeah, but I mean, I love working with people, working with families, just working with the whole household, right? Everybody's a part of it, and it's like its own ecosystem, and everybody gives and takes, and everybody has such a different and fresh perspective on situations, right? That they may all experience. So I love it.
Well, I'm sure you're great with your. I mean, I'm sure you're great. I'll take your word for it. I'm not going to go visit you anytime soon, even though I do suffer from anxiety and depression, right? But I am sure that what you do for your patients is of the top of the very best care, right? I've had the pleasure. We went and visited the facility. Was it like last month, Chris? And it was great. It was great. It was very, very, very hospitable. what is the word I'm looking for? Very, very gracious people. The hospitality was amazing. Very friendly staff. So shout out to Palms. You guys are great.
Did you guys get to walk through the hospital?
We didn't do
No.
a complete walkthrough, but we were able to go in the conference room in that first little section area off to the right.
Yeah.
So one of the really cool things about the hospital is that even the conference room, the front lobby, it's kind of all extending to all areas of the hospital. So a lot of people that have never been here before, it can be very scary, very daunting to say, oh, I'm going to go to the psychiatric hospital to get help. But really, it's very nursing home style. So, I mean, everybody has their own bed and their own showers, and we have a place for them to go do recreation. We have several outdoor areas for them to, play games or just to kind of hang out and enjoy the day.
I'm glad you brought that up because, I guess there's a stigma with psychiatric hospitals, right? That you go in, you check in, they take all your rights away from you. You cannot leave until somebody says you can leave. And then you're walking around in a room with people that kind of, aren't in their right mind or banging their head against the wall, or there's that negative stigma to it. So I'm glad you were able to kind of clear that up, that's not what you get when you're at Palms, correct?
Correct. Yeah. And we deal with that all the time, especially for first-time patients that come through here. So I used to actually work in the admissions department, and that was my favorite because it was like I got to talk to families and patients and be like, whatever you thought it was, it's not that, and reassure them and educate them and let them know that, it's not going to be like what you see or what you thought it was. So, I mean, we do have patients that are acute, we have different levels.
Of course.
But we will make sure that everybody is where they would benefit the most from their treatment, right? If they're aggressive and acute, they will be with the other patients that are like, so they can all be working towards the same thing. So that's a lot of worry that people have, especially when it's a family member, right, of an adult person, and they're like, oh my gosh, I can't believe they're going to the hospital, super concerned, right? Rightfully so. But it's a great opportunity for education because not everybody knows what we do or why or how we do things,
Yeah, society has placed in, and you'll like this being that you enjoy sociology, and I have a major in sociology as well.
Nice.
It's crazy that the stigma that society has placed on anything psychiatric or mental health. I mean, just like you said it, and Matt said it too, when you say psychiatric hospital, people just go left and right and never actually what it is.
Yeah.
So yeah, as Matt said, I'm glad you were able to clarify that a little bit. And
now, not to cut you off, Chris, but just out of curiosity, what age range do you guys treat? Is it, I mean, I'm sure there's adolescents and I'm sure there's adults, right? What is the kind of the range of the demographic for the treatment that y'all provide?
So we start off at the age of 12.
Okay.
And it goes all the way up, and we even have a geriatric treatment plan. So for those elderly above the age of 65 that are having a psychiatric condition, right, they can still come into the hospital. We really don't put a limit on that, right? As long as they're able to perform ADLs, as long as we're able to help them, really, it doesn't really matter.
I love that.
Yeah.
I love that. I love that. And how many people do you, I mean, we're not going to hold you to the number, right? But how many patients do y'all usually treat annually? Like, what is?
Oh my gosh. Well, annually, I couldn't tell you, right?
It's enough. It's a lot of people, right?
I do know that we are a 92-bed facility, and we're pretty high up in our census every day, right? Patients constantly coming in and out. Unfortunately, I don't have the information annually. I'm sure somebody else on my team would, but it's a good amount of people because as many people as we're discharging, we're bringing other people in. If you work in the inpatient admissions department, you will know there's always people in the community that need help to some level, right?
I'm glad you brought that up, right? And because the next question, from just hearing what you said, to be able to recognize like, hey, I have an issue and I need to go seek out treatment, or a family member of mine saying, hey, and I'm just using this as an example, like, hey, Matt, there's something wrong with Matt. He seriously needs help. Let's get him to Palms, right? Or I need to go to Palms. I need to seek out treatment, whatever the case is. What is there? I guess the fear is that I recognize that I need help and I go to Palms or a facility and I get turned away. What, I mean, that's not going to happen there, right? Like you guys are going to make sure that whoever comes to you, you're going to seek out help for them, correct?
Yeah, definitely. So one of the really good things about our facility is that we're open 24 hours, right? And we have licensed clinicians around the clock. I mean, because crisis doesn't, pick a time.
It's
right?
not 9 to 5. It ain't Dolly Parton, right? There's no crisis, Dolly Parton crisis, right? It ain't 9 to 5.
They can come in at any time, right? A lot of the times they'll ask just for basic information, and then we'll get to talk to them, or they will come in crisis fully manic, or having a crying episode, or some stuff has happened to them and they're not able to cope. So at least if for whatever reason they're not meeting the criteria for inpatient, we are still able to talk to them. And a lot of the times, really truly, that's what people just need, to connect with somebody, to feel heard and valued and listened to, and to give some empathy, right? Sometimes that's enough for them, and they'll be like, you know what, okay, let me make some goals for myself, and I may not need inpatient, I may not need outpatient, but you know what, let me go get connected with a therapist. And they do provide those referrals if for whatever reason they're not meeting criteria, right? So we're able to do that. But a lot of the times you see that they really just need somebody to talk to, and to feel that, you know what, your concerns are valid, and we understand, and normalizing and providing education and all that stuff. So it's great. And we have a lot of patients that leave here, and we let them know, hey, if whatever reason you need to come back, come back. If you just need to talk to somebody, call us. We have somebody on the phone. And we get a lot of patients that love coming back. They know their resources, which is great. We always say, like, we don't want to see you here, but if you need to, like, come back,
Yeah. Well, I'm sure that's a testament to the treatment that they're receiving, right? They feel like it's a welcoming environment, and that stigma and that fear has been washed away because they received quality care from you guys, right? And so that's not surprising at all. It's not surprising at all.
So I'm not sure if you can give this information out, or we're not asking for the secret herbs and spices or anything, but when you say criteria, they have to meet a certain criteria for inpatient. If they don't, they go then outpatient. What does that criteria look like?
So the criteria is, it's danger to self, in whatever that looks like, danger to others, or out of contact with reality. So we, during the assessment process, of course, we use like motivational interviewing, just to kind of talk with the patient and see what's going on. What made you walk into this building today? Because that takes a lot of courage.
It does. It does.
It takes a lot of courage for somebody to say, hey, you know what, I'm having suicidal thoughts right now. That is a very scary thing for somebody to admit to themselves, and then to say to somebody else out loud, So I always like to, when I used to work intake, asking the patients, something must have led you to come here today. What was it? And sometimes they may not have the insight to say, you know what, I'm having these thoughts, but through interviewing them and talking with them, they can identify, hey, you know what, I went through this yesterday, and I decided that I couldn't cope, and I felt hopeless, helpless. And it's kind of a way also to get them comfortable with talking about feelings, meeting with somebody, building rapport, and identifying some of the things that are going wrong with them, because that's not a skill that everybody has, that you can be in tune with yourself. So it's just, even if they come in for the assessment, we're able to do that with them. So it's nice.
Yeah, that's really nice. Seems like even if you can't physically help them, you can still help them, get them to someone that can. So that's great. It's good that you guys just don't wash your hands and say, oh, we can't help you.
Oh yeah. Yeah, no.
Yeah, good luck. Just
good luck.
Oh no.
Yeah. No, I doubt that I doubt y'all would ever seriously just turn somebody away without either helping them yourselves or finding care for them, that could someone could help, you know, so
Yeah.
of course. And how long have you been doing what you do? Like, I know you said you worked intake, but
mhm.
how long have you been with Palms?
I've been here Palms for it'll be 4.5 years already.
Wow.
So it's been a while. Didn't think I would want to do psychiatric treatment. Never thought I would go into that. But it's my calling, you know. I love talking to people,
I love
helping
that.
people. And when you find something that you love, you know, you're
It's
gonna
not
do
work.
it. It's not work.
No.
It's not work.
So, okay. So I'm glad you touched on that, right? So, you know, what you said, when you find something you love, it's not work, right? But I'm sure, and you don't have to go into detail. I'm not asking you to go into detail, but I'm sure the stories or the episodes or the things you hear,
Oh yeah.
they can take a toll on you personally, right? So how does Elizabeth maintain that, you know, that freshness or that kind of that balance to where you can come in on a daily and do your job without that burnout or without that, you know, without it really affecting you mentally and physically, right? Because I'm sure it takes a toll on you. So what do you do to kind of help?
So, you know, I mean, you said it correctly. The days are hard sometimes, right? Some days you hear things that are a lot, but I think anybody working in a therapy, social work, APS, CPS in our field, right?
Yeah.
It's hard, right? So I think the most important thing for me is to make sure that I thrive on my social connections. I'm a very social person, so I need to make sure that my social battery is charged so that I'm ready for the day, right?
Okay.
So, because some people can be, you know, if they start to experience burnout or anything like that, can withdraw from others and be like, oh, work was hard, but you know, I'm just going to keep going, right? But really, it's so important to identify personally what helps you take care of you, right?
Recharge. Yeah.
Oh, definitely. It can be whatever it is to everybody, right? For me, it's hanging out with friends, being with my family, doing things that we like to do, even though that maybe other people may not like, right?
Yeah.
But identifying that early on, especially as a mental health professional, and going back to that when you're feeling that I'm getting tired, you know, I had a very stressful day, right? And just finding that balance. And we actually have a group, the self-care group with the patients also, because for them they're like, what the heck is that? That's not real.
Yeah.
You know, so we like to talk about, you know, self-care. What do you like to do for yourself? And there a lot of people are not familiar with the term, right?
Yeah.
So
Yeah.
it's nice to practice what I preach, right? How can I tell you to learn about self-care if I'm not doing it myself, you know?
Yeah.
So yeah, I'm a social person. I like to go out.
Yeah.
You know,
Okay. So you like to go out. So just to clarify,
Mhm.
it's not like you're Facebooking in the morning right before you go to work, like social like that. You're
Oh
like,
no.
I'm going out, I'm
Yes.
having dinner with friends, I'm
Yes.
going to the movies, I'm going to birthday parties,
Yes.
I'm going to, you know, quinceañeras
Absolutely.
and things like that, where I'm just being actively social
Yeah.
amongst peers and friends and
Yes.
family, right?
Being around others, going out of town, you know, planning things like that, and just disconnecting are great, or are great ways. But I love to be around others,
Yeah.
talking, you know, usually talking about mental health, and everyone's like, I don't want to hear it. But I still do it anyway. It makes me feel good.
Yeah,
Well,
I think my family says the same thing about me. I talk about it too much. And they're just like,
Yeah.
already, come on.
and you know what? That's really refreshing to hear, because I guess you could, you know, you could be kind of a recluse, right? You could say like, okay, I'm dealing with so many other people's issues and problems
For sure.
that I just kind of want to take a break and not deal with people
Mhm. Oh, for sure.
and just say I need time for me. But
Yeah.
you recognizing that your time for you and able to recharge is actually spending it with other people
Mm-hmm.
and not distancing yourself to
Yeah.
try and, you know, deal with it. I think that's amazing.
Yeah, I think it's also most people don't think that way. But we are social and emotional beings, right? So that's how we thrive. We thrive in connecting with others socially and emotionally. So even if I'm with, a bunch of friends at a dinner, I'm getting the best of both worlds. I'm having those social connections, but also emotional connections, letting them know I had a rough day or I had a really good day, and
Uh-huh.
them vice versa, right? So, I mean, that's how we thrive. We see a lot of that, the negative effects of like when COVID happened, that a lot of people were ripped out of their their
Without
jobs,
a
their
doubt.
schools, their senses of security.
Mm-hmm.
So that was kind of a turning point for me. I'm like, all these people are getting ripped out of their day-to-day lives and they're not thriving on their social connections. And then we saw an increase in anxiety and depression, and mainly anxiety and depression, right? People were not able to cope. They weren't with their friends, their peers, their coworkers, right? And
Mm-hmm.
that is so important.
Oh, I got married in November of 2019, and then the pandemic hit 2.5 months later.
Well,
So it was like, okay, now I'm spending time with this new bride in a confined space with you know, by ourselves until we got our dog. And I think our dog really helped kind of not saved our marriage, right? But really helped save our sanity.
yeah, they were
Because,
a buffer. Mhm.
yeah, of course you love your spouse, right? But being confined and not being able to connect with the rest of the world and going out with friends and things like
Yeah.
that, it really, really took a toll
Yeah.
on us, as I'm sure it did with everybody else, right? And so, yeah, if I would have lived closer to Palm, I live in San Diego now, but if I would have lived closer to Harlingen, I've probably been a patient.
You
So,
could have been in PHP. You could
yeah,
have come during the day and programmed all day, go to the groups, and then go home.
yeah, I could have. I'm
That's your
glad.
time
Talk
to
about
win.
PHP. What exactly is that y'all offer?
It's the Partial Hospitalization Program. So that's our
Okay.
outpatient. And like I said, well, one of the things that we identify is a lot of the times patients have stressors, and it's their family, right? It's the family dynamic.
Tell
It's
me about it,
it's
Elizabeth. Come on.
boundaries, it's communication, it's all kinds of things, right? Hormones, if you have teenagers in the house, it's just a lot of things, right?
Yeah.
So with our PHP patients, they come in and they learn about all kinds of things. Their thinking patterns, they're learning about all these things, medication management. They're speaking with a nurse. They're doing all these activities during the day, right? Learning. They go home and they get to practice really what they're working on, and then the next day report back, hey, this, I tried this, this didn't
Yeah.
work, I wasn't able to express myself, whatever, and they get to report, and then they go back and they do it again the next day, right?
I love that.
Especially also with our partial hospitalization, if you're taking a medication for the first time, and you have some sort of adverse effects, you don't see a psychiatrist for another 3 weeks, 4 weeks, right? You may decide,
Mm-hmm.
oh, I don't want to take these medications. You never get to see what they can do for you.
Yeah.
So here they're managed daily. They're managed daily to see what's going on. Are they helping you? Do you feel an
Yeah.
improvement? How are they helping you, right? And just kind of having somebody address those things, which
Mm-hmm.
is nice, because we have a lot of patients that leave here and they're like, oh, I decided I didn't want to take those medications.
Yeah.
They didn't,
Yep.
I felt better,
And y'all, it's basically the approach like y'all are helping steer the car
Mhm.
and teaching that person to drive
Yeah,
versus, hey, you got a new car, there's the driver's seat,
figure it out.
figure it out, right? It's more of a hands-on approach to learning and
Yeah.
managing what that person or what that patient is going through.
Mhm.
Now, we're running out of time, but one of the last questions I have, and then I'll let Chris kind of ask his question and take it home. But as far as insurance,
Mhm.
is it, do y'all take cash payment? Do you take insurance? Like what kind of, if I need to go see you guys, what can I expect um to help get the treatment?
Mhm.
Good
So we do take insurance, and we are partnered with the local MHMR. So for any of those persons that may not have insurance but are in
Yeah.
crisis and are needing to be hospitalized, we can work with them to find a way to get them covered.
Okay.
Um, if not, you know, fully, then partially, or whatever.
Something. You
Yeah,
can get them help.
something.
Yeah.
Yeah, for
Yeah.
us, I mean, for me as a clinician, um, you need help, you need help.
Yeah.
There's no way I'm gonna let you leave this building if you say, hey, I'm suicidal and I'm gonna overdose on my pills that I have at home. I'm gonna need to make sure that I can safeguard your home first.
Yeah.
And if that needs inpatient hospitalization, then that's what we're gonna do, right? And I have
love
to
it.
find that way, that delicate balance of explaining that to the patient, right? Because a lot of times, they won't want to stay, but you have to
Yeah.
explain to them the safety and they just want to help them.
It's scary. It's
Mhm.
scary. Imagine, having thoughts like that. You want to, you want to take your own life, but then you're convinced to stay,
Mhm.
but you're afraid that you're going to get a $30,000 bill.
Exactly.
Like, hey, you're keeping me alive, so to speak, or you give me the tools to stay alive, but now I got this $30,000 bill in 30 days. Like,
Mhm.
it's a scary thought, so.
Yeah, and a lot of the times, I mean, we don't want to add an extra burden, right? So we have to find a way to make it work, right?
Yeah.
Because a lot of the times patients come here with stressors, multiple stressors, and we don't want to add one more. We want to make it as easy as possible for them, and make sure that they just
Help.
know we're doing the best for them that we can.
And for clarification, right? I just use $30,000 as just a number. I don't know what you guys cost. I'm just throwing a number out there. So it's probably less than that. I actually got the number from, I saw something on social media about the helivac, if you're in an accident and they bring in the helicopter to take you to the ER. That service alone can cost $65,000.
Jesus.
Okay.
Yeah. So I'm just, and I don't, again, for clarification, I do not know what Palms charges for services. I was just throwing a number out there. So, don't hold me accountable for that.
They're going to come ask you.
Yeah, they're going to come after me. That's it with our relationship with Palms. This is the one and only episode, right? No, you guys are great, and I'll let Chris take it away, but thank you so much, Elizabeth, for joining the show. You are amazing. You're welcome back anytime you want to come back and share stories or share information, whatever, what have you.
All right.
Or just to be social. If you want to be social on the show.
There you go.
For sure.
So I have one question, and I know we're running out of some time, but you were talking about suicidal ideations, and you wouldn't let them go home if they had mentioned something like that. So do you guys do a 5150 hold, like a 72-hour hold? Do you guys? Okay.
Yeah.
And what
most of the time, usually if they're coming in voluntarily, they're walking in through our doors, they already have an idea that this may be happening, right? They may be hospitalized. In some cases, we have family members bringing in their loved ones, right, voluntarily for the assessment. They may not know what's going on with them, but they know something's not right. When we do the assessment, we find out, hey, you know what? They attempted overdose last night, right? Or they attempted an overdose this morning. In those cases, we do have to file a hold, right? Especially if they don't want to stay, Do we get upset patients? Absolutely. But we want to make sure that we can give them safety, right? At least for the 72 hours, so that we can talk with them, build rapport with them, educate them, connect them with resources. Because a lot of times they come through the doors and they have never had an outpatient therapist, an outpatient psychiatrist. They have never talked about these thoughts, right? So getting them connected with resources post-discharge can be beneficial to them, right? Especially if they've had a good experience and they're attending the groups and they're doing the individuals and all that stuff. Then them leaving, they may have a better idea of, okay, I can do this. I can talk to somebody. Everybody talks about, emotions or sadness, depression, whatever. And it's okay.
Mm-hmm.
Good. That was a good answer. I like that.
Fantastic.
Oh, thanks.
Fantastic.
You are always welcome back, Elizabeth. You were great. I enjoyed it. Anytime you want to come back, come on back.
Awesome. Thank you.
And before you leave, how can our listeners get in touch with Palms? Is there a website? Is there a phone number?
Yeah. So we do have a website. It's palmsbh.com. On the website, there'll be a 1-800 number where you can, call and they'll direct you to the right person. But if you need to get in contact with somebody right away, you can call 956-365-2600, which is our direct hospital line. And then you can ask to speak to whoever you want. And we are open 24 hours, 7 days a week. We don't close Thanksgiving, Christmas, New Year's, COVID. We're always open.
Well, Elizabeth, there is a reason why you are the first guest from Palms on this new relationship, because you absolutely slayed this episode. So thank you again for joining Mind Split Cafe, and let us know if you ever need anything.
I will.
All right.
From me.
All right. Take care. Tune in next week, guys. We'll have another great guest and another great episode on Mind Split Cafe. Like Elizabeth said, you can reach out to her on palmsbh.com, and tune in next week.
Thank you, everyone.
Bye.
Take care.
Like, we weren't supposed to come up with something this clean. Like, something happened.